pain management is very complex. It goes far beyond, I'll give you a pain pill that will take care of your pain, the pain is gone. There is a lot of modifiers that we have built in our body that will affect how we perceive the pain. So we know the pain tolerance is different between people. We also know that it varies a lot in various situations. One of the big modifiers of pain is anxiety. There is an anxiety management that becomes very important. I call it psychological domain to the pain management, because if you have a good idea of what's going to happen and how things going to happen, then you being relaxed about this will help modulate the pain. This becomes very, very important topic of me when I sit down with my patient before we do the surgery. It's very important for me in one form or another to tell them that I got their back, that if they're going to have a pain, this is going to be taken care of. A lot of times when patients request for the stronger pain pills, it's not necessarily that they have a terrible out of control pain, they just worry that it's going to get there. So for them to know that I've managed hundreds if not thousands of patients with post-surgical pain and I got their back, that they don't have to worry about the pain getting out of control. We're not going to get it there because we have a good protocol that we know it works. It becomes a big deal. It's management of expectations, it's management of anxiety. So if somebody is anxious going into the surgery, they're going to perceive the same pain as the person who is not anxious completely differently. So there's little things, even giving a patient map and explaining where they're going to check in so they don't have to worry about things, will change how their pain level is perceived. Playing pleasant music when they go to sleep in the operating room will modulate how they're going to perceive pain afterwards. Just simply knowing that, we have a lot of resources and we do have a very good protocol of how we're going to manage the pain, that we're not just going to take the narcotics away. No, we have a very good plan. Our patients will receive 3 non-opioid medications in the preoperative area way before we ever made an incision or created any type of pain stimuli. So by the time they wake up from the surgery, those medications are already on board and they already kick in. The goal of our protocol was to decrease the use of narcotics because they have a lot of side effects, drowsiness and nausea and constipation, and you cannot operate vehicle or heavy machinery because you consider to be under influence, right? We were trying to decrease the time, the duration of opioid therapy, decrease the number of pills that people were taking to decrease the side effects. But what we found out is most of our patients, like 95 to 98% of patients who undergo thyroid and parathyroid surgery, do not need any opioids at all. They just don't even ask, because the other discussion that we have with my patients in the preoperative area, when they come in and if they're concerned about the pain control, I'll talk to them as, if you have a bad headache, and most of us have had bad headaches, that could be 5, 6 out of 10, bad headache. You're not going to go on and just go get a narcotic for a bad headache. You're going to take, maybe a couple ibuprofens or Tylenols and maybe get in a relaxed environment, and you wait half an hour and it subsides, because this is what's going to happen. There is a medication that will control pain, doesn't have to be narcotic, and what the expected outcomes are. And I tell them this is going to be a major surgical procedure. We do not want to get your pain bad. We definitely don't want it to be intolerable. But we have a very good medication. They don't have to be narcotics. We have very good medications that will take care of pain. There are some people who do require narcotics because of various issues. That is available to you, but it's not necessary for most of the patients. So this psychological domain, this sitting down with the patient and managing expectations, is probably the most important aspect, even more important, I think, than all of our pharmacological mix that we do them. So that's single most important aspect.